The member for Ryan.
Thank you, Mr Speaker. I rise to support the member for Dobell's motion regarding National Stroke Week. In doing so, I commend both the member for Dobell for moving this private member's motion, as well as the National Stroke Foundation for their ongoing work to raise awareness of the symptoms and treatments for stroke. Strokes can occur in all age groups and among people at all levels of fitness. However, the risk of stroke does rise with age, and it is more common in men and in people with a family history of stroke. There are also certain lifestyle risks that lead to an increased risk of stroke. For instance, high cholesterol, cigarette smoking, obesity, poor diet, a lack of exercise and drinking large amounts of alcohol can all contribute to an increased risk. However, the largest preventable risk factor for stroke is high blood pressure. The Stroke Foundation recommends that blood pressure be controlled through regular exercise and maintaining a healthy weight, and also through medication if necessary. For people who are at risk, the Stroke Foundation recommends regular checkups and monitoring. Treatment will vary depending on the type of stroke experienced, but the most important factor is time. The sooner you can respond and start treating a stroke, the sooner you will improve the chance of survival and of successful rehabilitation. To get the message across to all Australians, the National Stroke Foundation recommends F.A.S.T, F.A.S.T, the test the best way to recognise common signs of stroke. As the member for Dobell pointed out, F.A.S.T is an easy way to remember the acronym that stands for Face, Arms, Speech and Time. When examining a person for signs of stroke, they recommend you should firstly observe the face. Has the mouth dropped? Arms, can they lift both arms? Speech, is their speech slurred? Do they understand you? And time, act quickly and call 000 if any of these symptoms are present. The F.A.S.T method is incorporated into the new Acute Stroke Clinical Care Standard released by Minister Lee in June this year. The standard sets out a clear process that clinicians should follow when assessing and treating patients suspected of stroke, and is a sign that the government is serious about ensuring stroke patients are treated safely and effectively. Indeed, stroke is so prevalent that most of us will know of a colleague, friend or family member who has suffered a stroke. In my electorate of Ryan alone, on 2014 figures, there are 2,553 people who are still alive despite having suffered a stroke. While most are aged over 70, 413, or more than 15%, are aged under 55. Stroke awareness will only become more important in the years to come. There were 295 strokes in Ryan in 2014. However, with the ageing of the population and an increased prevalence of some lifestyle factors, that number is expected to more than double to 660 by 2050. But, Mr Speaker, there may be good news on the horizon. Given the increasing public health challenge posed by stroke, there is significant research currently underway into new treatment methods that may revolutionise the way we test stroke in future. A good example is research being undertaken by the Queensland Brain Institute, located at the University of Queensland in my electorate of Ryan. There, researchers have had some early success in the study of brain damage caused by strokes, news of which I shared with the House earlier this year. Researchers have discovered that the worst damage to the brain is often not caused by the stroke itself, but by what happens to the brain afterwards when it is trying to repair itself. During this process, blood clots can form in the brain that can then cause the inflammation that results in brain damage. Scientists at the Queensland Brain Institute have successfully located a molecule that causes the damaging inflammation. Studies in mice have shown that it is possible to inhibit this molecule using a drug known as CAL-101. This is an exciting new discovery that, if proven in humans, could lead to new treatments that dramatically reduce the severity of brain damage caused by incidents of stroke, aiding rehabilitation and long-term recovery. Mr Speaker, this again reinforces the importance of time. Strokes, when recognised early, are far more treatable and are far less likely to cause long-term damage. If we can achieve one thing this week, it would be to encourage more Australians to pay attention to the symptoms of stroke and, if necessary, seek treatment immediately. Once again, I commend the National Stroke Foundation for their campaign and encourage all Australians to familiarise themselves with the F.A.S.T, F.A.S.T method, One day it may just save a life.